Hi folks, today I'd like to talk about the Myofascial Bodywork Common Injuries Workshop, also known as the Medical Massage Workshop. Now this workshop is a 4-day workshop and it covers 4 classic injuries and conditions that practitioners usually see in their practice that their clients come in with. So what I'd like to do today is show you a brief demonstration of some of the things that you would expect to see in this 4-day workshop. So the common injuries and conditions that we cover are frozen shoulder, carpal tunnel syndrome, knee and ankle issues, and headache and TMJ issues. For the carpal tunnel syndrome day, we cover conditions surrounding tennis elbow and golfer's elbow and how to work this area to relieve symptoms that clients may come in with, how to identify range of motion limitations in this area, and how to work myofascial tissue in this area. And then for carpal tunnel syndrome, one thing that I really like to show is how to work the carpal bones in order to give range of motion. So being able to work the carpal bones to give range of motion for an area that may have gone through inflammation, that the client may have had restriction, compression in this area. So working these bones will help to give space to this area and hopefully give some relief. For frozen shoulder day, we end up working in this area for folks who may have adhesive capsulitis and frozen shoulder, and usually these folks will come to you with some sort of pain issue here around their arm, but what may be happening is that this area is overworking and having to compensate for restrictions around the shoulder. So we first learn how to assess this area and how to assess for restrictions around scapula, and then we feel for directional resistance in the tissue around scapula and then work this area in order to relieve symptoms in this front part of the arm. A very successful set of techniques that have helped a lot of my clients who have had frozen shoulder. For the TMJ and headache day, we learn how to work inside the mouth, do intraoral work, how to palpate for pterygoids and masseter, and how to help folks who have TMJ disorders, clicking of the jaw, and sometimes tracking, off-tracking of their jaw. So we learn how to assess that and how to work inside the mouth properly and specifically to help with those issues. With headaches, we learn how to feel for directional resistance in the myofascial tissue around the head, not just muscle tissue, but also fascial tissue, and not just on top of the head, but also the suboccipital muscles that can contribute to tension headaches and cluster headaches. And finally, for the knee and ankle sprain day, we learn how to work the knee, and not just the front of the knee that can give us problems, but also how to palpate and work the back of the knee, the popliteus and plantaris muscles that can sometimes, when they're tight, give issues to the client. And sometimes clients who are cyclists and runners or active clients may feel tightness in the knee and maybe they think it's actually hamstring, but we learn how to assess, how to feel for directional resistance in the back of the knee, and that can just give a world of relief for folks and get them back into their active lifestyle. So we learn front and back of knee. For the ankle, we learn how to give range of motion and free up restrictions, specifically in the tibio-talar joint. Folks who have healed from an ankle sprain may feel tightness, and even though the ankle sprain has healed, they may still feel restrictions in this area. So we learn how to assess for restrictions and how to give range of motion freedom here in this area, and particularly the tibio-talar joint. So that's it, folks. Looking forward to sharing all this wonderful information that has helped me, helped my clients, and look forward to seeing you in future workshops.